Hi, my name is Janis Moriarty, and I'm the president of the Massachusetts Dental Society. News may change rapidly, but our commitment to our members does not. The Massachusetts Dental Society values the health and well-being of all of our members and the public at large. While the risk of transmission of the coronavirus that can cause COVID-19 in the United States is still low at this time, it is important that your practice's infection control procedures and protocols are up to date and enforced. The MDS urges you to implement the following recommendations in your practice today. Schedule a huddle with your staff to discuss the current outbreak and develop a consistent message that the patient's well-being in the practice is the entire dental staff's #1 consideration. Remind your staff that the continued use of standard infection control precautions keeps everyone safe. Review the Centers for Disease Control and Prevention, CDC, standard precautions guidelines for infection prevention and control in dental settings and make sure that they are being followed. Encourage your staff members to recognize signs of respiratory illness in themselves and to stay home if they are symptomatic. Per the CDC, anyone who shows signs of fever, cough, or difficulty breathing and has been in close contact with a person diagnosed with COVID-19, or anyone who lives in or has recently traveled from an area with an ongoing spread of COVID-19 are asked to call their physician. Physicians will work with the Massachusetts Department of Public Health and the CDC to determine if they need to be tested for COVID-19. You should also develop a coverage plan in the event that staff members need to self-quarantine. Don't forget to disinfect your reception area at least daily and consider removing magazines and pamphlets from the area. Review the latest information and guidance on the outbreak. The CDC's COVID-19 situation webpage is updated daily and offers current insight on the outbreak and the CDC's response. The Massachusetts Department of Public Health offers statistics and information specific to the current situation in the Commonwealth. The American Dental Association has also created a coronavirus webpage that provides answers to frequently asked questions, information on patient assessment, and availability of personal protective equipment, otherwise known as PPE. Check your inventory of PPE, specifically masks and gloves, to be sure you have an adequate supply. The CDC is providing current updates and guidance on any PPE shortages, including information from suppliers and distributors. Inform your patients. Reassure patients that the infection control protocols and standard precautions already in place in your practice are an excellent deterrent to this virus. Ask your patients to reschedule appointments if they are symptomatic or have traveled to affected areas. The MDS will continue to monitor the situation and keep members informed of any new developments or recommendations. Please be sure to read all the communications we send to you. We also encourage members to continue to check the CDC website, cdc.gov, and ada.org for the most current information and updated guidelines. It is important to stay calm and informed. If you have any questions, please contact our Member Assistance Center at 800-342-8747. This information is also available on the Dental Practice Insights webpage at massdental.org. Thank you.